Welcome back. DRASA, which stands for Dr. Ameyo Stella Adadevoh Health Trust, is a public health organization focused on promoting safe water, sanitation and hygiene, reducing and preventing the spread of infectious diseases, and strengthening health emergency preparedness in Nigeria. Currently, DRASA is supporting the fight against COVID-19 as a member of the Emergency Response Operations Team in Lagos State. Till date, DRASA has trained over 600 health workers to serve in COVID-19 treatment centers around the country and support Nigeria's response as frontline health workers. DRASA's Managing Director, Niniola Williams, joins us on the program. Mrs. Williams, welcome to our COVID-19 update.
Thank you for having me.
All right. Dr. Adadevoh saved Nigeria, preventing a major outbreak during the Ebola era. Tell us briefly about this initiative and what informed DRASA.
Yeah, so, as everyone is aware, in 2014, Ebola came into Nigeria, but we were largely spared, partly because of what my aunt, Dr. Ameyo Adadevoh, did with her team and the government. We saw what happened with our neighboring countries in West Africa, and we were largely spared. And so as a family, we came together and decided that we had to do something to ensure that Nigeria was prepared and had a resilient health sector for a time like this.
So it's been a number of years, 6 years since the Ebola threat, and we're facing a huge epidemic right now called a pandemic. How would you describe the country's response so far?
It's been good. I think polio helped us deal with Ebola, and Ebola is helping us deal with COVID, right? So we have some experience with these kind of things. We've seen a lot of support coming out of the private sector. Private-public partnerships and collaborations have been driving a lot of the response, and government has done a fantastic job as well. But there's some areas that it's not a perfect response. There's some areas that could improve, and one opportunity that we see is supporting the health workers, those on the front lines.
Tell us what more happens in the emergency response operations of the Lagos State.
Yeah, so we're part of the infection prevention and control team, and so we're responsible for equipping all those who are going to serve as part of the response, whether they're collecting samples from suspected cases, ambulance drivers, cleaners that work in the treatment center, doctors and nurses, and so on. And the idea is to equip them to be able to do their jobs while protecting themselves at the same time. Also doing things like facility assessments to look at the flow and the structure of these places that are going to house patients.
And is that working?
Yeah.
What you're trying to achieve?
Yeah, I mean, you can't just put someone who doesn't know how to fly a plane in front of in a cockpit and tell them to go, right? You need to equip them, you need to empower them, you need to give them the confidence to be able to do it in a way that protects themselves at the end of the day.
So looking at the infection prevention and control, which is a key component in this pandemic, are we doing good? Are we doing great?
We're doing well, but again, this is emergency mode. This is crisis mode. So what we're doing is we're responding and reacting. Infection prevention and control is something that countries around the world have struggled with, but it's something that we need to improve in Nigeria, both during COVID and even afterwards, because we know, unfortunately, COVID will not be the last thing, and we need to ensure that people around the country can quickly identify, detect, and contain any threats.
Tell us a bit more about DRASA's impact, especially since it is named after Dr. Adadevoh herself.
Yeah, so we do a lot of work in communities, schools, and especially vulnerable communities. We've partnered with people around the country, both local and international partners as well, reached 30 states. We've trained and empowered 24,000 students, over 1,000 teachers, and over 300 community leaders, but our core is really the health workers, and we've engaged and trained over 1,000 of them, trying to build a workforce, a network of people who can do what she and her team were able to do in 2014.
Are there major hindrances, challenges to this work?
It's difficult. IPC, infection prevention and control, is not something that's part of our health system right now. But even as I say health system, what is a system? It's comprised of people, human beings. So we really have to invest in the human beings that make up our health system to be able to help them protect themselves while serving on the front lines and protecting the rest of us. And in terms of the hindrances, I think it's an upcoming field. So there's a lot of work that needs to be done. But that's why we're here and that's why we're committed.
You think if we're hit by another pandemic, we'll be able to survive with what we have, our response to this pandemic?
Honestly, it's hard to tell. I mean, this is something unprecedented around the world, but I think that one of the things we need to look at is how do we become more resilient on the other side of this. We don't want to come out of COVID and go back to how things were before. I think this is definitely going to be a new world that we're entering, and we need to ensure that our health sector, specifically our health personnel, are trained on IPC, that they're ready and capable at all places, not just in the hospitals, at the points of entry, land borders, seaports, everywhere, so that anything that comes next, we're in a better position to deal with it.
So a lot of people are being advised to keep safe. There have been talks about transmission in hospitals to patients. How are you solving that?
Yeah, so that's one of the challenges. Again, when you don't have IPC as a practice, a general standard of a health system, these things will happen. And it's very unfortunate because it causes a lack of trust and confidence in the health system. And also it makes health workers afraid to do the work. And so, our focus is empowering them, building their capacity so they can be confident and ready to do this.
Tell us more about drazatrust.org and how people can get involved.
So right now, one of our biggest initiatives is looking at how we can set up a training center, and we're looking for partnerships, sponsorships, and people who can collaborate with us to do that, because we know that that's the only way forward. So people can visit our website, www.drazatrust.org, learn more about what we're doing, the trainings we're doing, and find ways to collaborate and partner with us.
I want to quickly ask your thoughts about improving Nigeria's healthcare system. Amidst some of the things you've talked about, the training and what Draza is doing. Talking about Nigeria's healthcare system, how you think we can improve this? I know you talked about the problem of the IPC, issue. So what more do you think we need to do?
There are gaps, but I think that generally it comes back to the human beings. If you don't build, you can build all the infrastructure you like, bring in all the equipments, bring in all the PPEs, but if the human beings in the system are not ready or capable, then we have a bigger problem.
Because you've trained over 600 healthcare workers, and they've been spread across the states. Some people would question the capacity of maybe a state in the north than perhaps one that's in the south.
Yeah, exactly. And that's why, again, it's a gap. And it's hard to fill that gap in a time of emergency because, we're racing against time. Every day there are more cases in more places. So that's why we have to look at this as a sustainable solution, something that we do not just in a time of emergency, but even afterwards.
And the state government, how are they responding to this?
Very well. Again, we're blessed in the sense that we had Ebola to prepare us for a time like this, as well as polio, Lassa fever, meningitis, monkeypox. We've had so many infectious diseases, and other countries around the world haven't had to deal with these things before.
But there's some people who criticize government measures to sustaining this fight.
Yeah, nothing is perfect, but the government has really done well, I have to say that.
All right, we appreciate your time. Mrs. Niniola Williams, Managing Director, Draza Health Trust. That's Dr. Mayo Stella Adadevoh Health Trust. Thank you for joining us on the program.
Thank you for having me.
Now, in the United States, President Donald Trump is planning to put pen to paper over an executive order temporarily suspending immigration to the country. The decision, according to Mr. Trump, was made in light of the COVID-19 pandemic and the need to protect jobs of Americans.
Should be based on the data and the public health principles.
As many countries seek an end or partial end to their lockdowns, the World Health Organization is once again warning that this should be a gradual process. The WHO says premature relaxation may lead to a surge of new COVID-19 infections. The number of deaths linked to COVID-19 in the U.S. is now more than 42,000, by far the highest total globally. The same goes for the number of confirmed infections, which is over 787,000. But despite the continuing spread in some parts of the country, several states are easing lockdown restrictions or are planning to do so shortly, following pressure from protesters condemning the stay-at-home orders. Meanwhile, U.S. President Donald Trump says he plans to sign an executive order to temporarily suspend immigration to save American jobs. Over the last 4 weeks, more than 20 million Americans have made jobless claims. In other developments, Hong Kong has announced an extension to social distancing measures until May 7. There have been 1,025 positive tests and 4 deaths in the territory. And over in China, 11 new cases have been reported, of which 4 were imported. Of those, 6 were from the province of Heilongjiang, which is on the border with Russia. In positive development, over in Italy, the number of people officially identified as infected with the coronavirus has fallen for the first time since the country's outbreak began. And some more good news, this time coming from West Africa. Mauritania has recorded no new cases 2 days after the last patient tested negative. The country had initially recorded 7 confirmed cases of the virus, but 6 patients recovered and 1 died.
And CDC continues to work closely with states. You can find the latest national strategy to scale up access to coronavirus disease testing in Nigeria and other public health advisory on the disease. The website comes alive with all those details. Also, the World Health Organization live feed is also live with regular updates, strategy on their website, guides to the public health response at both national and subnational levels. And that's our COVID-19 update at this time. Another update comes your way at 9 p.m. Join us then. Continue to get more updates on our website, www.channelstv.com. I'm Melissa Ntumwaka. Goodbye for now.